What's up everybody, Dr. Rossi and welcome to the Shrinks and Sneakers community. I'm a passionate adult psychiatrist who's board certified and whose mission it is to make psychiatry more accessible and provide cutting edge information about the diagnosis and treatment of psychiatric disorders. So please subscribe to the channel for weekly videos dropped every Monday. So I've come across several people over the years, either in clinical practice or personally, who have this peculiar interest. And that peculiar interest is in popping pimples or other dermatological manifestations. And I think that says something about the popularity of people like Dr. Pimple Popper on YouTube, who essentially just makes videos all about popping pimples that people find very satisfying and enjoyable. But my question is, what happens when that skin picking becomes so excessive that it results in sores all over your body, all over your face potentially? This is a different manifestation, and that's what we're going to talk about in this video. Now, you may have guessed it already. We're going to be talking about a disorder called excoriation disorder, and it's also sometimes referred to as dermatolomania. Very weird name, has nothing to do with bipolar disorder, and very difficult to say, as you can tell by my pronunciation. Now, this disorder falls into the category of what we call body-focused repetitive behaviors, which is essentially a form of OCD in many ways. And in fact, the DSM-5 places this in the category of obsessive, compulsive, and related disorders. Now, this is a compulsive behavior. And what I mean by compulsive is that there's a tension or anxiety that builds up in the person before they perform the act, right? There's a tension and anxiety and I need to pick my skin, and what ends up happening at that point is the person then picks, and when they pick, they feel relief of that tension or anxiety. It's kind of the same thing that occurs in OCD, obsessive compulsive disorder, where the person has an intrusive thought that leads to anxiety or tension, and then they have to perform some kind of compulsion or compulsory behavior to relieve that tension. So a classic example of that is I'm worried about contamination on my hands. So as a result of the anxiety and tension about this potential contamination, I have to wash my hands excessively, sometimes to the point where it takes me several hours a day to adequately complete this washing ritual. Now, I want to point out for you guys an important point, because this is actually very different than maybe what you've heard of in certain recreational drug use disorders like opioid use disorder, cocaine use disorder, methamphetamine use disorder, where people have what they call a sensation of crawling under the skin. They feel like they have a sensation of bugs crawling under their skin. And this can present, like I said, in certain withdrawal and intoxication states. Most notably, I think of alcohol withdrawal as one of the possible ways that this can occur. Another way that this can occur is with prolonged cocaine use, and this is actually not called excoriation disorder. It would be called formication. And formication is not a anxiety or OCD type of sensation or OCD type of disorder. It's actually a tactile hallucination. So the person's actually having a tactile hallucination of bugs or insects crawling under their skin. And often with prolonged cocaine use, they call this coke bugs. So to meet the criteria for excoriation disorder, it's actually quite simple. There's really not much to it and not much to say here. So you have to have, of course, repeated picking of your skin resulting in injuries. So you can't just pick your skin, you have to pick your skin to the point that it becomes injured. Now, the second part is recurrent attempts to stop picking. So I'm trying to stop picking my skin, I just simply can't because of all this tension and anxiety. As a result, it now is starting to become a disorder. Why is it becoming a disorder? Because I'm spending a substantial amount of my time picking at my skin. I could be spending hours a day, and those hours could be divided up into multiple sessions of picking, or it might just be one long session where I'm picking for several hours at a time. Now, it cannot be explained by another medical condition or psychiatric condition. And some people have even gone on to say that they feel that this is just a manifestation of things like obsessive compulsive disorder or body dysmorphic disorder, because let's say, for example, I'm upset with a particular facial hair on my face and I have to keep tweezing it off repetitively. That would be more of a body dysmorphic disorder because I have this perception that there's some imperfection on my face. So the common locations of skin picking actually include things like the face, the arms, the shoulders, scalp, and the fingers. Most people will actually squeeze with their fingers, so they'll squeeze the location, say on their face, where they're going to be picking. Others use tools such as tweezers, but this is by far less common and would not be considered the most common way that people are picking. Some people target things like pimples or scabs exclusively, but that's not always the case. A lot of times people with this disorder will be picking at normal skin or healthy skin until it becomes damaged, of course. Now, some people who pick the scabs or the pimples will actually spend quite a bit of time either playing with the scab in their hands and or chewing on it in some cases, which I know is a little bit odd, but it does happen. And they'll also do the same thing with pimples. They might be playing with the contents of the pimples, the pus, etc. that is removed from the picking or squeezing. Now, most people actually choose a specific location that they enjoy doing this picking or that they choose to do this picking at. And that could be, again, the face, it could be the arms, it could be the shoulders, etc. But there's usually a preferred area that the person has. And some feel that it's, again, associated with a perceived defect. So they feel anxiety or tension and have to pick at the location. The example being, say, facial hair that doesn't look right. It's common for this to start in adolescence, and it's usually a chronic disorder. A lot of people end up dealing with this for their entire lives. It usually goes undiagnosed. In most cases, patients don't present, say in the setting that I work in, where I work in an inpatient unit, they don't present because of excoriation disorder. They will present possibly because they had a suicide attempt related to the fact that they couldn't stop picking, but it will not be primarily for the excoriation disorder. So it largely goes undiagnosed, and people don't talk about it. There's a lot of guilt, there's a lot of shame, and a lot of embarrassment with admitting that you have this disorder. And in severe cases, it can actually result in significant medical complications, including things like infections and possibly sepsis, which could land you in the ICU if you're not careful. So treatment of excoriation disorder is a tough one. There's really not much that we have to treat these patients, so there have been things that have been tried, and it will make some intuitive sense when I talk about it. So there's no FDA-approved medication for this disorder. However, if you follow the line of thinking that this is a form of OCD or it's in the OCD spectrum, then you might suspect that high-dose SSRI medications might have an effect. However, the data is inconclusive at this point and quite limited, and we might even ask ourselves, were the doses high enough in these studies and were they long enough? Because we know with OCD patients that doses of things like sertraline can be as high as 300 milligrams a day, and things such as fluoxetine can be as high as 120 milligrams per day to get the full effect. And often people with OCD have to be on these medications much longer, in most cases, say 12 weeks at least, before they start to see the full effect. Other medications have also been used, and those include clomipramine, which makes sense because that's a medication commonly used in OCD, olanzapine, as well as naltrexone is another example. So naltrexone is a mu-opioid receptor antagonist, and it's actually one that I used in a severe case of excoriation disorder myself. And unfortunately, I did find that the results were kind of disappointing. It didn't seem to help all that much, but this goes to the idea that it will eliminate that reinforcing effect or pleasurable effect associated with the skin picking. Now, the psychological treatments are probably a little more well established. Those are things like cognitive behavioral therapy and habit reversal training, which are also used in OCD in general. So habit reversal training, you would take the behavior of skin picking and replace it with something like fist clenching. So every time the anxiety and tension built up in me to pick my skin or pick my face, I would instead clench my fist. So I replaced one behavior with another behavior. So I'm going to hold the video there for you guys. If you have questions or comments, please drop them below. I'm happy to try and answer them. And if you haven't subscribed to the channel already, please do so that I can keep providing quality mental health information to you.